Hello, my patient is a 22-year-old female soccer player. She came into the athletic training room after a soccer game on September 21st. She was complaining of pain on the lateral aspect of her right ankle. She says that during the game, she went in for a tackle and is unsure whether she rolled her ankle or if another player had stepped on her ankle. But she was able to continue playing and did not need to come off the field due to this. She completed the game and did not say anything to the athletic trainer during the game or immediately after the game on the sideline. Coming into the athletic training room, she does not present with an antalgic gait, but her pain is a 2 out of 10 while walking and sitting. She denies any numbness, tingling, or shooting pain up or down her leg or her foot. Upon examining her ankles bilaterally, her right ankle does not show any ecchymosis or swelling. Her active range of motion is full and equal bilaterally in all directions, but is painful, as well as her resistive range of motion is full and equal in all directions, but it was painful. Nothing more than a 4 out of 10 was what the patient stated. Upon palpation, patient did state that the pain jumped up to a 6 out of 10. This tenderness was found over the anterior talofibular ligament, the sinus tarsi, the lateral cuneiform, and the cuboid. Her squeeze test and bump test were both negative. Her anterior jaw compared bilaterally was negative. There was no laxity found, but it was painful for her right ankle. Her talar tilt inversion eversion were both negative bilaterally, as well as was the Kleiger's test. We also performed compression of her tarsals and metatarsals, and this was negative. She did have a little bit of discomfort, but stated that this was nothing more than the pain she felt while walking and sitting. The tarsal glides did have some pain, but that was only due to our hand placement on her foot. Otherwise, it was negative for any laxity found in her midfoot. Her tarsal metatarsal glides with the fifth, fourth, and third metatarsals were negative, and distraction was also applied for these 3 metatarsals, and all of this was negative for pain and laxity. So our assessment today is that she has a grade 1 sprain of her right anterior talofibular ligament and suspecting a contusion to the dorsal surface of her right foot. Patient was given an ice bag there in the athletic training room and instructed to report to the athletic trainer the next day to let them know how she was feeling. Depending on how the patient was feeling and if their ankle felt weak or did not feel stable enough, the patient would then have their ankle taped, and if the contusion on their lateral aspect of their foot was bothersome in their shoe or their cleat, then a pad would be given to relieve some of that pain. On a side note, this patient did come in the following day and had no pain. She said she was just fine, did not need to have her ankle taped or to have a pad put into her shoe, and has not had any issues since.